with your favorite person, eating your favorite meal in your favorite restaurant, when all of a sudden they get a call. They answer with a smile that fades for a second. When they hang up, when they hang up, they start crying uncontrollably. You're confused and try asking what's wrong, but they brush you off. The ride home is quiet, the type of quiet that makes your skin crawl. When you arrive home, they tell you what the call was about. It was from the doctor's office, informing them that they have been diagnosed with cancer, breast cancer. Your heart sinks, and you have no words. This happened to me, and it inspired me to do my research about breast cancer, and learn the causes of breast cancer, the behavioral symptoms, and the treatments. Breast cancer is a disease caused by genetic, environmental, and lifestyle factors that affects both physical and mental health. But understanding its causes, symptoms, and treatments can lead to better awareness and improved outcomes. Let's first explore what the causes of breast cancer are before finally discussing what the symptoms are and the treatment. Causes of breast cancer. Breast cancer is a disease where cells in the breast grow out of control and form a mass, called a tumor. While it occurs almost entirely in women, men can also develop breast cancer. Hormones play a significant role in the development of many breast cancers. Lifestyle-related risk factors, such as a diet, physical inactivity, may influence hormone levels and thereby increase breast cancer risk. Although the exact biological mechanisms remain unclear, hormonal imbalances, particularly involving estrogen and proestrogen, are known to contribute to the transformation of normal breast cells into malignant cells. Approximately 10% of breast cancer causes are linked to inherited genetic mutations. These mutations are passed from parents to offspring and are present in cells from birth. The most well-known inherited mutations occur in the BRCA1 and the BRCA2 genes, which are tumor suppressor genes responsible for regulating cell growth and repairing DNA damage. When these genes are mutated, their protective functions is lost, allowing abnormal cells to proliferate. These mutations are classified as hyperpentropes mutations, meaning they significantly increase the likelihood of developing breast cancer. Families with a history of breast cancer often carry some vulnerability genes. Families with history of breast cancer often carry such inherited genetic alterations. Although some vulnerability genes may remain unidentified, about 90% of breast cancer cases are irregular, meaning that they result from acquired genetic mutations rather than inherited ones. These mutations occur over a person's lifetime and are limited to breast cells. Acquired mutations may arise due to exposure to radiation or carcinogens, environmental and lifestyle factors, and random errors during DNA replication. These mutations often affect oncogenes and tumor suppressor genes, disrupting normal cell regulation. Unlike inherited mutations, sporadic mutations are not present at birth and cannot be passed to offspring. Tumor suppressor genes normally control cell division, repair DNA errors, and initiate programmed cell death. When these genes are mutated or inactivated, cells lose their ability to regulate growth effectively. Mutations in tumor suppressor genes, such as BRCA1 and BRCA2, can lead to the accumulation of abnormal cells, ultimately resulting in cancer. Oncogenes originate from normal genes called proto-oncogenes, which regulate cell growth and division. When mutations occur, proto-oncogenes, which regulate cell growth and division, when mutations occur, proto-oncogenes become oncogenes, leading to uncontrolled cell proliferation. This type of breast cancer develops when these activated oncogenes continuously signal cells to grow and divide, contributing to the tumor formation. Now that we've taken a dive into the causes of breast cancer, we will go over the behavioral symptoms. According to J. Lynn Offal, fatigue is a common and distressing side effect from breast cancer treatment, affecting 25% to 99% of patients, with a 30 to 60% experiencing moderate to severe symptoms. While it often improves within a year, some survivors experience fatigue for up to 10 years. It has multiple causes, including psychological factors, medical conditions, and biological changes. Effective treatments include exercise and psychosocial therapies. While medication provide limited benefit, J. Klein-Onkel includes insomnia as and mentions that insomnia is common among breast cancer patients, affecting 20 to 70%, with about 19% meeting diagnostic criteria. It can occur at any stage of treatment and is linked to reduced quality of life, including fatigue, depression, and impaired functioning. Causes are multifactorial, involving psychological and biological factors. While medications may provide short-term relief, cognitive behavioral therapy and approaches like sleep hygiene, mindfulness, and yoga are more effective long-term treatments. Depression is a common side effect of breast cancer. J. Klein-Onkel says that it affects 20 to 30% of women, with about 99% experiencing major depressive disorder symptoms and are often highest in the first 6 months after diagnosis, and can impact quality of life and treatment adherence. Causes include psychosocial and biological factors. Screening tools like PHQ-9 help with diagnosis, and treatment includes therapy and antidepressants. J. Klein-Onkel mentions how cognitive disturbance or chemobrain is common in breast cancer patients, affecting 60% to 75%. Chemotherapy can cause mild to moderate problems with memory and thinking, sometimes lasting up to 10 years. Causes may include neurotoxicity and inflammation and hormonal changes. While there is no standard treatment, cognitive behavioral strategies can help improve function and quality of life. Now that we've covered the behavioral symptoms of breast cancer, let's discuss the available treatments. According to Rupin Shah, Kelly Rosso, and David Nathanson, postoperative treatments after lumpectomy or mastectomy depends on lymph node status and tumor characteristics. Node-negative patients typically receive whole breast radiations, while those with positive nodes may need additional regional radiation. After mastectomy, radiation may be avoided in low-risk cases, but is recommended for patients with nodal involvement or longer tumors. Mastectomy is a common breast cancer surgery, with about 30% to 40% of patients in the US undergoing the procedure. Types vary based on disease severity and include simple, skin sparring, and radical forms. It is often combined with sentinel lymph node biopsy to check for spread and some cases. Prophylactic mastectomy is performed to reduce cancer risk. Reuben Shaw, Kelly Rosso, and David Nathanson include that axillary lymph node status is important for determining breast cancer prognosis and treatment. While full lymph node dissection is now mainly used for patients with confirmed node involvement, sentinel lymph node biopsy is a safer option for node-negative patients. Studies show that SLN biopsy alone provides similar survival outcomes with fewer complications, making it a preferred approach in selected cases. Reuben Shaw, Kelly Rosso, and David Nathanson say that adjuvant therapy in breast cancer improves survival by targeting hidden cancer cells. It reduces reoccurrence and mortality with chemotherapy, further lowering risk endocrine. Therapy is standard for hormone receptor positive cases and targeted treatments like trastuzumab benefit HER to positive tumors. Advances genomic profiling also help guide more personalized treatment. In conclusion, breast cancer is a serious disease that affects millions of people and is caused by a combination of genetic, lifestyle, and environmental factors. It not only impacts the body, but also emotional and mental health through symptoms like fatigue, depression, insomnia, and cognitive changes. However, advances in medicine, including surgery, radiation, and adjuvant therapies, have greatly improved survival recovery rates. By understanding breast cancer, we can promote early detection and support those affected and encourage hope through continued research and awareness.